Welcome, everyone, to Chapter 42, Rehabilitation and Restorative Care Nursing. We're going to dive into the heartbeat of long-term care, and this is helping residents regain or maintain the abilities that matter most in daily life. Rehabilitation and restorative nursing, they're not just tasks, they are processes that support someone as they rebuild strength, as they rebuild their confidence, and they regain a sense of self-control. So, as you follow along through this chapter, think about what it feels like to lose the ability to do something that you've always done without thinking. This could be things like walking to the bathroom, brushing your teeth, tying your shoes. And then imagine having patient, encouraging support as you relearn those skills. That's the heart of this chapter. So, the purpose for today is simple: understand your role in helping residents work toward their highest possible level of function. We are not necessarily aiming for perfection. What we are hoping for is for them to be their best today. So, your encouragement, your pacing, and the way you explain a task, all of that shapes the resident's success. Refer to the chapter introduction in your textbook for the definitions of rehabilitation and restorative care and the goals of each. And that's going to give you a lot of good insight as we work through this chapter together. So, a disability is any lost, absent, or impaired physical or mental function. Key terms for Chapter 42 are important, so have a look through those. Disabilities can be temporary or they can be permanent, and they can affect one part of life or they can ripple through everything. That includes mobility, communication, self care, and social interactions. So, recovery starts with a shift in focus. The shift is from what someone cannot do to what they can do and what they can relearn. Box 42.1 has a list of some common health problems that require rehabilitation. And so it's a good reminder of how many different conditions that residents might be recovering from. It could be a stroke, it could be fractures, it could be amputations, or chronic diseases. So as you listen today, here's your hidden ticket to class. Jot down one example of a small action that a CNA can take that helps a resident feel more involved in their own progress. So, rehabilitation is a process, it's not a moment. Your textbook describes it as restoring someone to their highest possible level of function. That means we don't rush and we don't judge progress based on how fast it happens. Some residents improve quickly, whereas others might need weeks or even months of repetition and reinforcement. Rehab is a team effort. We have physical therapists, occupational therapists, and speech therapists who assess needs, they set goals, and they teach techniques. CNAs are the ones who bring those techniques onto the unit every day. This can be during bathing, during dressing, assisting with mobility, during mealtime, as well as walking. You'll see in Figure 42.2 how different therapies contribute different aspects of recovery. So, throughout the rehabilitation process, residents may experience frustration, fear, denial, or even angry, and this is particularly so early in the process. Your textbook emphasizes that rehabilitation involves the whole person. This is the physical being, the psychological being, the social being, and it also can include some economic aspects. There's a section in your textbook called Rehabilitation and the Whole Person. I'd like for you to have a read through this. So, your role is not to fix the emotions, but to support the person through them. A calm tone with clear expectations and patience can really shift towards positivity in the entire session. So, restorative nursing picks up where rehab leaves off, or sometimes it runs alongside it. So think of it as everyday practice that helps a resident maintain or slowly improve abilities. Examples from your text are range of motion exercises, or ROM, ambulation, practice feeding, practice grooming, and practice toileting, It could include using assistive devices. And as you work through these, encourage pacing and rest breaks. Restorative care helps prevent complications from immobility like contractures or pressure injuries. Box 42.2 illustrates some CNA responsibilities, and this is an excellent quick guide for you. So this slide here is the core of your practice. Your role includes encouraging independence even when it feels slow, giving emotional support and celebrating small steps, following the care plan and the therapy goals exactly, practicing good time management so residents don't feel rushed, reporting changes in strength, mood, or mobility. Residents sometimes need reminders of their progress, and so your textbook points out that celebrating even small gains builds some motivation and self confidence. And remember, allowing extra time for a resident to button their shirt or stand up safely is not slowing down your shift. This is the work, this is why you're here. So, rehab programs or rehabilitation programs can be inpatient, they can be outpatient, they can be long-term care, they can be short-term after hospitalization, or they can be for ongoing chronic conditions. So OBRA requires nursing centers provide rehabilitation services. And what varies is how intensive or frequent the therapy is. So where does CNAs fit in this? We fit in with consistency. You make sure that the resident gets their daily practice. It's not just therapy hour practice. If you've ever been coached as a kid learning to play an instrument or taught someone how to drive, you know how much repetition matters. And the same is true here. And this is your job as a CNA. Repetition matters. So follow that care plan. Rehab and restorative care uphold a resident's sense of dignity and independence. And these are huge contributions to an individual's well-being. Remember that this isn't just about physical function, it's about helping people feel capable and respected as they rebuild skills. And some of the most meaningful progress happens during daily routines. So, this could be letting the resident choose their clothing or offering options in grooming. It could be supporting the resident to walk through the dining room instead of using their wheelchair. Allowing time to practice eating with an adaptive device. You can do this in private as well with them so they can practice before they get out what they feel like is in public. There's a discussion in the chapter on when privacy supports dignity. Just like the text says, privacy, respect, and encouragement all support the resident's progress. So after reading chapter 42 and listening to today's lecture, reflect on how you as a CNA can support both safety and dignity during daily care. This reflection question helps us connect the chapter's big ideas, function, independence, and supportive care, to your everyday practice as a professional. I look forward to reviewing your reflection question response in your journal. Thank you.